Okay, everyone, welcome to lesson 9 of the Health and Wellness for Older Adults course. So today we're going to be talking about physical fitness. Okay. Oh gosh, darn! We started on the wrong slide. It's okay. It was just the intro slide. It's fine. So, anyways, what are the components of physical fitness? So first of all, we have physical activity, which is really just any movement that's produced by skeletal muscles and expands energy. Okay. And then you have exercise. So this one, exercise is actually planned, it's structured, it's a repetitive body movement, and you do this to accomplish or to maintain or improve one or more components of physical fitness. Okay. Has a difference. Okay, so physical fitness, this is a set of attributes that people have or achieve that relate to the ability to perform physical activity. Okay, so this is being physically fit. If you can do the physical activity, or if you don't have the ability to do the physical activity, that's your physical fitness, right? And then we have cardiorespiratory endurance. Okay, the ability of the body's circulatory and respiratory systems to supply fuel during your physical activity. Okay. Some more components of physical fitness. So then we have aerobic physical fitness. So this is where you're working. This is when you have oxygen. Okay, and anaerobic is without oxygen. Okay. So maximal oxygen consumption is the amount of oxygen taken in and distributed when a person is exercising at their maximum rate. Okay, so like when you're running really fast, what's the most amount of oxygen you can take in? Okay, and allow to kind of move around, to go to all your cells. Right, and then the muscular endurance. This is the ability of your muscles to sustain the work over a period of time. Okay, so that time in between when you start the work and then when you fatigue, it's that sweet spot where you're able to do the work. Okay. Okay, so some more components. We have muscle strength. So this is the ability to apply force to or by contractions of your muscles. Okay, so when we myelin and I forgot. Shoot. But when we're contracting our muscle cells, they go like this. And then when we're expanding it, when we're doing the opposite, our muscles go like this. They elongate. So when you contract, when you're picking something up, or you're squeezing something, you're contracting those muscles. Your muscles are doing this. Okay, and then when you bring it back out, they go. Okay, so this is muscle strength. It's the ability for this to happen. Okay, through force. Okay, so body composition, the proportion of fat, muscle, bone, and water that makes up all of this. Okay. All right, so some benefits of physical activity. So first of all, it's going to decrease your death rate. It's going to reduce your body fat and weight, improve your lipid profile, and then improve your insulin sensitivity. Okay, so your insulin sensitivity, whether you can take in sugar and get your cells to absorb the sugar, so it's not just running around in your bloodstream, causing a lot of sugar. When there's a lot of sugar running around your bloodstream, there can be a lot of problems. So you want insulin to be released so that it's going to get your cells to soak up that sugar and use it as energy. So it's going to improve your insulin sensitivity. And then your lipid profile as well. So this has to do with our cholesterol levels and things like that. Okay, so some more benefits of physical activity. So it's going to increase your cardiovascular endurance and aerobic capacity. Remember, aerobic is with oxygen. Okay, it's going to maintain your bone mass, increase muscle mass and strength, increase postural stability, which I have an issue with clearly, balance and flexibility, and then improve your overall well-being, your sleep, your cognitive function, everything like that. So benefits of physical activity, man. So some hazards of inactivity, or basically what happens if you sit there all day and do nothing. Okay, so in the past, bed rest was often prescribed. Okay, if you have an ailment, you should rest. Okay, but now we know that just laying there and doing absolutely nothing does not promote healing. Okay, so there are many attributes of old age that are linked to having that sedentary lifestyle where you just kind of lay around and don't do much. And so that old saying, or I know they usually attribute this saying or apply this saying to other things, but it definitely applies here. If you don't use it, you lose it. Okay, you don't want to lose function of your body, so you need to keep your body moving. Okay, so older adults should be encouraged all the time to do the maximum activity that they can do. Okay, because that's going to allow them to keep their function, to hold on to their function as long as possible. Okay, so you exercise to prevent and treat heart disease. Okay, the role of exercise in the prevention of heart disease is very well documented. It's pretty much common knowledge now. So it is not clear really what level of exercise intensity is actually needed to make a difference, but we do know that you do need a decent amount of physical activity. Okay, especially like your cardio. Cardio is very important. So cardiac rehabilitation programs out there always include exercise for heart disease, angina, and heart attacks. So very important to treat heart disease, you gotta exercise. So hypertension. When you get hypertension, those who engage in regular exercise usually have a lower incidence of having hypertension. Okay, even among those who are overweight. Okay, you still have less of a chance of having hypertension if you exercise regularly. Also, walking to the point of moderate pain with resting periods in between will definitely increase a pain-free walking time and distance. So yes, maybe in the beginning of your exercise regimen, it may be a bit difficult, it may be painful, okay, but the more, when you do it to that point where you are in pain, or if you exercise, you lift weights to that point where you're in pain, or you really start to fatigue, you definitely can't do another rep. After you rest, you come back maybe a day or two later, and you do the same exercise, you're gonna find out that you just increased your ability to even do more. Okay, so each time you push yourself to that point, to that limit point, you're just increasing your body's ability to do more next time. Okay, you're getting healthier and whatnot every single time you exercise. Okay, so type 2 diabetes. Diabetics who exercise regularly will need fewer oral medications and insulin because their body cells are more sensitive to their own insulin production. Remember, when you exercise more, it increases your insulin sensitivity, right? And then for obesity, those who are overweight can feel better and lose weight with exercise. Okay, and now if you have respiratory diseases, exercise can help improve lung function and prevent further deterioration caused by inactivity. Okay, and then with osteoporosis, weight-bearing exercises, okay, lifting weights, okay, weight training can prevent or reduce the decline in your bone loss in both premenopausal and postmenopausal women. Okay, for those with arthritis, a range of motion exercises, okay? A lot of this is like, actually yoga works really well, also aerobics and things like that. Well, those type of exercises will help place stress on the joints. Also with swimming and, those type of exercises, and these are really, really effective for older adults, whether they have rheumatoid or osteoarthritis. Okay, so I can say, yeah. Anyways, lower back pain. So for those who have lower back pain, exercises that strengthen the back and the abdomen, or basically the whole core. Exercises that strengthen your core can reduce the risk of back injury through better posture, strength, and flexibility. So some exercises that will help strengthen your core, if you're into weightlifting, a lot of powerlifting exercises, definitely, because you have to focus on your core to even lift heavy. You have to, when you lift like a lot of weight, you have to tighten your back, okay? You have to tighten your core, you got to tighten your booty, and all of that has to work together. Even if you're doing like curls, or you're doing some bench press or squats or anything like that, you have to tighten everything if you're lifting a lot of weight. And that compound exercise is going to really strengthen your core, and it's going to lower your back pain. Now, many older adults may not be able to do powerlifting, okay, but some other things that do help with back pain would be yoga and like aerobic exercises as well. Okay, so if you have cancer, physical inactivity may play a role in the development of several types of cancer, okay, particularly in cancers of the colon and the breast. So, of course, physical activity would help prevent that. And if you are for depression, aerobic and strength training exercises is a great alternative for medications for depression among older people, but also everyone else, okay? Because it releases a lot of endorphins after when you're doing these exercises. So it really helps with depression or anxiety and things like that. Okay, so exercise as a prescription for health. Okay, so to determine how much and how hard you have to exercise, you must consider what your goals are. Okay, and your state of health, the state of health that you are actually in right now. Okay, where you are now and where you want to be, you need to kind of figure that out. Okay, and then that way you can figure out exactly what exercises may be best for you. Walking is a great way to start exercising, 30 minutes a day on most days, at least half of the week. Weight training should be mixed with cardiovascular exercise for the maximum benefit. Okay, so what are some risks and complications of exercise? Suffering from angina or heart attack while exercising is actually a serious complication, but strenuous exercise is not harmful to a normal heart. Okay, so if you do have heart disease or anything like that, extreme strenuous exercise may not be best. Okay, you probably want to do more light exercising. In general, exercise should do no more than leave the participant or leave the person who's exercising pleasantly tired the day after. Okay, so you shouldn't feel completely incapacitated, you can't get out of bed, it hurts too much, things like that. So before beginning an exercise prescription, an assessment should be conducted. Okay, but a healthy person can usually just begin exercising. If you have a disease or you have any kind of chronic illness or anything like that, you should probably just kind of see a physician first and figure out exactly what steps you should take, what might be best for you. Okay. So older adult activity level. So the activity level is especially low in older adults. So older adults are poorly educated about importance of health and exercise. There are many beliefs out there about exercise, and today they're a bit different. Okay. Until recently, older adults were told to just calm down, just slow down, don't do too much, go sit down. But we're learning today that that's actually going to reduce their function. That's going to send them to an institution a whole lot sooner than they need to be. Okay? So older adults need to be encouraged from their healthcare professionals and, of course, their family as well. And everyone needs to help push them to take care of themselves and be physically active. All right, older adults activity level. Older adults may have symptoms of chronic disease that make exercise a bit difficult, and some older adults don't even want to exercise. Okay, so there are facilities for exercise that may not even be available. Okay, there may not be gyms available for all older adults, and many older adults might not even have proper transportation to go to a gym or go to the park or wherever they want to go exercise. Okay, so they may experience some level of difficulty while they're trying to become more active. So, implementing effective exercise programs. First of all, providing information about the importance of exercise is very important. Okay, then you need to give social support to older adults about exercising, about the importance of exercise. Then we need support from health professionals. Okay, health professionals should be encouraging our older adults to get a whole lot more physical activity. Also, there may be psychological factors, so we need to keep in mind, be mindful of what's going on with the individual, and consider also cultural factors. Okay, there are maybe cultural factors that are, holding an older adult back from getting all the physical activity that they need. I know that culturally, and in my home or in our home, because my father is from Pakistan, my grandmother, she's from Pakistan. She's very Pakistani. She's not culturally, she hasn't adapted to American culture. So and it's in the culture to serve our older adults, to serve our grandparents. So she expects, hey, I'm the grandma. You're supposed to bring me my food. You should be cutting my apples. You guys you're supposed to be, giving me a glass of water if I need it, or asking me if I need something, not me getting up to have to go get it myself. Okay, that's disrespectful if you make me go get it myself. You're supposed to be asking if I need something. So there may be cultural factors similar to that could be holding older adults back from, getting very much exercise. Okay. Then, so exercise promotion. How do we promote? Implementing effective exercise programs. So, we should have appealing facilities available for older adults. frail older adults probably will definitely need more special facilities. So many gyms out there, the really big ones, will have like, certain equipment that help older adults who are a bit more frail and need assistance, which is great. There's that one machine that they do where they like help lock you in, like in the jacuzzi or in like the pool, where it kind of provides a lot of support for them to get some exercise while they're in the pool. So things like that. Physicians need to motivate individuals to begin and sustain a physical program. Okay, individuals need to be motivated after being diagnosed with a disease. Okay, because many times when you're diagnosed with a disease, you can be kind of everything sucks. But so when that's going on, when you're initially diagnosed with a disease, you need to be motivated, encouraged. Let's try to inspire these people to keep going and keep moving, and maybe it will help their disease. Of course, it will help their disease. So we need to create or to encourage older adults to have achievable goals, health goals, physical goals, okay, and find ways to hold them accountable for their physical goals. Okay, so what is the role of the physician in this whole mess of exercise promotion? So physicians should and are the best spot to discuss the need for exercise, because physicians are usually really connected with their patients, especially the primary care physicians. Okay, they're usually pretty connected with their patients. They know their history, they know what's going on. If they're part of some sort of managed care organization, that physician is definitely coordinating all their care. So the physician would be the best spot to discuss need for exercise. Physicians can formalize a recommendation by writing an exercise prescription, and then sometimes with some insurance providers they can do that, and then the patient can actually get their gym membership from that. So that's cool. Physicians do not commonly counsel their patients to start a program, but they should. I mean, many times they can be more vague, very vague actually. Physicians are usually like, exercise, that'll help you, do some exercise, but they don't really get into it and go, okay, let's try to design your exercise program, or let me write you a prescription to get a gym membership, or to get exercise or anything like that. So what are some resources for older adults and professionals? There is AARP. Okay. What is this? Huh. Why? The thing isn't working. So this AARP, the Public Health Agency of Canada, if you're in Canada, the National Blueprint, the Active Aging Toolkit, and Healthy People 2010, well, not 2010, actually Healthy People 2030. Okay, so I hope you guys learned a lot from this presentation, and if you have any questions about anything, go ahead and hit me up, leave a comment or email or any other form of contact, and I'll get back to you. Until the next lesson,